Hi viewers, today we'll see geriatric assessment. In that first part, history collection. I am Dr. Kalaizalvi Xavier. At the end of the class, the students will be able to explain and to do focus assessment. Geriatric conditions such as functional impairment and dementia are common and frequently unrecognized or inadequately addressed in older adults. Identifying geriatric conditions by performing a geriatric assessment can help clinicians manage these conditions and also prevent or delay their complications. Geriatric care is very important and geriatric assessment should be done in appropriate time. Negligence should be avoided while assessing and care for geriatric patients. Here, what is geriatric syndrome means? It is a term that is often used to refer the common health condition in older adults that do not fit into distinct organ-based diseases categories and often have multifactorial causes. What are the common conditions of the old age? The list of common conditions are cognitive impairment, delirium, incontinence, malnutrition, falls, gait disorders, pressure ulcer, sleep disorder, sensory deficits, fatigue and dizziness. Some of the conditions common in older adults, they may have major impact on quality of life and also disability. Here the geriatric syndromes can best be identified by geriatric assist. Now we'll see some of the terminologies related to geriatric assessment. What is behaviors? It is a specialized term used in fields such as psychology, social science and education. What is intellectual? Intellectual describes something related to or using the mind or intellect. What is dentition? It pertains to the development of teeth and their arrangement in the mouth. What is cognition? It is a term referring to the mental process involved in gaining knowledge and comprehension. These cognitive processes include thinking, knowing, remembering, judging, and problem solving. What is polypharmacy? It refers to the use of multiple medication in the patient, commonly on older adults, while the most commonly used definition of polymorphacy is being on 5 or more medicines. Definitions are invariable. Now we'll see subject data in that history collection. Before to do the history collection, some of the safety consideration to be followed. Perform hand hygiene. Introduce yourself to the patients, what you are going to do it. Confirm patient ID using two patients identifier, usually name and also date of birth and also the record to be checked. Explain process to patient. Be organized and systemic in the assessment. Use appropriate listening and questioning skills. Listen while the patient is talking. Attend to patient cues. Ensure patient's privacy, dignity, and should do the documentation according to agency guides. In that subjective data, before to do subjective data, we have to collect the health history by interviewing the patients. The data nurse gather will help her focus on particular areas of concern during the physical examination. The focus interview questions related to geriatric assessment, the previous experience with illness, we have to ask the patient past history, hospitalization and also health agencies, nurses and nursing. Intellectual understanding, what is the interpretation of the health problems, diagnostic regimen, treatment regimen, specific questions or concern. Educational level and intellectual capacity. Language usage, what is the communication pattern, usual patterns of living, health, religion, recreation, pursuits, occupational and social roles and responsibilities, and what is the developmental status and level of the behavior, usual behavior of the patients, the old age, and also any crisis or stress, close relationship with whom, ability to help in these situations, what are their expectation, goals, needs related to their health care, we have asked. Here mention some of the domains of the items for comprehensive geriatric assessment of history collections. The domains physical health and medical condition, the suggested items to be asked, comorbidity conditions and disease severity, medical review, nutritional status, how they will take the food, and whether they are taking additional food for their health, polymorphisy to be asked, urinary incontinence symptoms it's present, or it how what is the level, sexual functions and visual hearing problems, they are using tension problem or a tension, what type of the desire, what is the method they are using. Other domain, mental health and psychological status. Here we have to ask cognition, mood and anxiety, fears, goals of care, advanced care preferences, and what is their spirituality. Other we have domain, we should ask functioning. Here the to be asked core functions such as mobility, balance, fall risk, whether the activities of daily living is daily routinely it changes, or it is they need any help for others, life life roles that are important to the patients. Then the domain asks for old age, social circumstances. Here to be asked informal support available from family and wider network of friends and contacts, statutory care, and also the financial concerns and poverty. Next domain should be asked about the environment. Here the suggested items is housing, comfort, facilities, safety, use or potential use of tele-health technology, anything, transport facilities, accessibility to local resources. Then to be asked how to interviewing the geriatric patients, no, in that to promote and efficient information exchange and enhance rapport with the patient, minimize distract and speak clearly before to do the history collections. We can sit together and comfortably eye to eye contact and put the patient at ease by explaining the reason for interview and giving a brief overview how you will going to proceed interview. Then the systemic collection of the subjective data from the health history includes both current and also past health status, and also elicit the chief complaints at present, what is the complaints that is going on, asking why the patient is seeking health care, find out when the patient illness and symptoms, ask about past illnesses that required medical attention as well as the hospitalization and other procedures. Then find out the patient has history of cardiovascular, respiratory problem, renal or neurologic disorder, because the diabetes means how long it is there, hypertension, cancer, injuries or any falls, we to be asked. Be sure to document all prescription and non-prescription medications the patient takes, including names, dosages and frequency. The areas of assessment that team members may choose to assess depending on the patient needs, who are all members to be helping the patients and assisting patients, the team members to be questioned current symptoms and illness and their functional impact, what are the current medication the patient is taking, other indications or effects or the relevant past illnesses, what is the recent and impending life changes is happening, objective measures of overall personal and social functioning, and current and future living environment and its appropriateness to function and also prognosis. Here also to be asked family situation and availability, and current caregivers network including its deficiencies and potential. The following to that objective measures of cognitive status, objective assessment of mobility and balance, rehabilitative status and prognosis of illness or disabled, current emotional health and substance abuse. The mainly to be asked related to health, nutritional status and needs. Okay, how they are eating, then what are the special diet they are taking, they likes food or they have any feelings of nausea or anything due to the medications complication to be asked. Disease risk factors, screening status and health promotion activities also to be asked. Services required and also received. While giving assessment and while carrying the patients in the history collection to be remembered, the elderly person decides be recognized as a person and not regarded as a room number, a disease, a problem, grandma or less of the person because of age. Be listened to, be comforted, to have distress recognized, perceive that healthcare workers are making effort to make him or her physically and emotionally comfortable. The aged person can tolerate pain if he or she is not being neglected. Be remembered, the person fears being overlooked and forgotten. To continue that, learn about what is causing health problems or distress in terminology that he or she can understand. Know what treatment and care is planned, length of treatment and what can be expected as an end result. Receive quality care, have some self determination about what activities he or she will take a part in so long as he or she does not injure self or others. This is a history collection. At the end, we have to write the inference. The elderly person may have many needs to be met, like physical, social, emotional, and spiritual problem. Okay, to be mentioned in that documentations. Often the following basic needs are overlooked, and however they can be met with little extra effort on the part of the nurse. Geriatric evaluation and management is very important, is care in which the primary clinical purpose or treatment goal is improvement in the functioning of the patient with multidimensional needs associated with the age related medical conditions. The patient may also have complex psychosocial problems. These are all the inferences and reference. Thank you.